Everybody, I'm the real Randy Chavez. This is Dr. Max Meltzer. He
Hey, everyone.
is a veterinarian at. Are you still doing two places?
Nope, just one.
All right, so he's at Levittown Animal Hospital.
Come see me.
And yeah, definitely come see him. I'll put a link down below. And you have been practicing for how many years now?
3 years.
Okay, so 3 years practicing. So you're 32? 33.
As of last week.
All right, so did you start practicing as soon as you got out of school?
I finished school and went right into the job I still have.
Oh, damn. Oh, so now that you're not like fresh out of school, you're not like wet between the ears, you have a few years experience, and you're not old school, what is something that was a shock to you when you first, like, oh, wow, they did not prepare me for this, if anything?
I would say that I've talked about this before with a lot of my classmates because we all came out at the same time. And it's just how little they prepare you for the client interaction.
With other people.
They could teach you as much medicine as they possibly can. They could teach you diagnose, surgery, how to refer, anything like that, but they can't teach you how to communicate with people effectively.
There was no classes on that?
There was 2 sessions of about 5-10 minutes each where you did a mock interview with some random local from the island I was on that they just gave a script. Most of these local people never had animals, and so they didn't really know how to feel. Like one of mine was about how to talk about euthanasia, which was something that is difficult and will always be difficult. Yeah. And if it ever doesn't get difficult, you tell me to quit. Okay. So how do you learn how to do that when it's your first time doing it?
Yeah.
And how many doctors will let you shadow euthanasia when the owner doesn't know you?
That's true too.
So it's things like that, or it's euthanasias. What about an angry client?
Yeah.
Or a client who thinks that you're not doing what you said you did? These are all things that I wish that they really would help with. And if I was ever able to be a teacher, it's something I'd really want to get in that, and how to better pay loans, because they don't really ever talk about that either.
Okay, so financial and then human interaction. What helped? Was it just jumping right in as Greg Louganis and just start doing it?
Yeah.
Or did you look up?
No, most of it honestly was finding a mentor who let me shadow. I think you've interviewed him, Nunez.
Nunez, yes.
And he was really, the first 3 months of me working there was pretty much just me in the room with him. He'd watch me do my thing, or then he would do his thing, or I would just watch him do it and then ask him questions after. If it was an owner he knew really well, he would let me do my whole exam, and then he would do his whole exam, and then we would talk about it.
Okay.
So it's things like that, and I got to see him do euthanasia. And then there's 3 other doctors that worked there at the time, so I got to see one of them do a euthanasia, and you just kind of learn from everyone else that's been doing it longer than you have.
Yeah.
And you could see the things that you like that they do and you want to incorporate, and the things that you don't like that you won't incorporate. Okay. Things like that. It's growing as you do it.
Did any of the owners, while you were in the room, like as you were, I guess, training, did they like kind of give you weird looks like, do I really want this like kid being my vet? Did you ever experience any of that?
Definitely. I've had a lot of people, not someone say as much like, I don't want you. I've had a lot of people say, you look young, especially when I'm clean shaven. Like, how long have you been doing this?
Yeah.
But my favorite question more than anything is, how do you know? You came to me. I went to vet school. I graduated.
Yeah. Well, I mean, part of it is, it's diagnostic. So if they're asking you, you don't know. That's why you're running certain tests depending on the thing.
But how do you know from the lab what it says? Why does this blood value mean what you tell me it means?
Do you do like an explain like a 5, like, okay, this is how it means, or you just say, based on the blood work, this is what happens?
I would say this, enzyme is tied to this body organ. If this enzyme is elevated, something's wrong with this body organ. If you're asking me what's wrong with that organ, something's wrong with the organ. Okay. Ultrasound, X-ray, MRI, CAT scan. Then I can tell you what's wrong with that organ.
Okay.
A sample of the organ.
Do you have fun with it? Like I am the manager type of feel, and then you just.
I like to have a crack a joke, unless it's a serious thing like a euthanasia, within the first 2 or 3 minutes of any appointment. And if I feel like the owner is vibing with me at all, that just makes the appointment more fun for both of us. I like to think. And if I feel like if I crack a joke or say something the owner doesn't give me any feedback, I'm like, that's not the type of interaction they want, and I'm just going to be business.
Okay.
But I always go for fun route first, unless it's something incredibly serious.
Yeah, that's how you make it fun. And you mentioned, speaking of fun, you were on an island in vet school. Is it in the Caribbean?
I was in Grenada,
nice.
Which is in the West Indies, for the first 3 years of vet school.
Did you have to get a bunch of vaccines before you went there?
I had already had some vaccines from traveling, but I did have to get 1 or 2 more. But then for any vet school, I needed to get my rabies immunizations.
Oh, yeah.
And that I did on the island because it was the only thing on the island all 3 years that was significantly cheaper than doing it in the U.S.
Oh, all right. Any other things like tetanus shots that you had to get?
I'd already had tetanus a few times.
Oh, why a few times?
Every time you got stabbed by something
Oh,
rusty and you're running
right,
around,
yeah.
you're a kid doing work, you slip, you got to go get tetanus. For some reason, in vet school, when you got bit by a dog, they made you get a tetanus shot. I got bit by a Jack Russell Terrier.
Yeah, small dogs are. Yeah, I've only gotten bitten by a dog once, and it was by a Jack Russell Terrier, and that was not fun. But you said when you were a kid doing stuff, is this something that you always wanted to do when you were younger? Or is it something like you kind of just fell into?
No, actually, I was so bad at science through high school. I didn't take a single science.
Really?
At my undergrad, I did a geology at a community college just to get the credits.
So were you doing, like, with geology, did you want to be like an architect?
I went for business.
Oh.
I went to undergrad for business. I graduated with a BA and, BS.
Okay.
And I didn't really, at the end, want to do it. So I didn't have a passion for it.
Yeah.
And I ended up graduating because, I was so close to graduation. I figured you have to finish. I was thinking about going to law school. I took the LSAT.
Oh, cool.
Did all right. Started filling out the applications and then knew that wasn't a passion either. It was just something to, hit pause.
Yeah.
So I took a job working construction.
Okay.
Just to...
Like as a day laborer?
Yeah, yeah.
Oh,
straight up.
So you had a BS and you were...
Fresh graduated, never worked in my field, took a job doing manual labor. And then 2 or 3 months into that, I was promoted to third in the structure of the organization, owner, manager, me.
Okay.
I was the only one that had graduated from high school or college.
Oh, my God.
And then they hired my best friend, Isaac, to work too, and he had just finished his poli-sci degree. So there was 2 college graduates, and we spent the majority of the day doing labor and mopping, which we laughed about all the time. When that got too much, I worked Sirius Radio on the air with 2 other guys. Cavino and Rich, if you see this, what's up?
That's great.
And that was great. It was Sirius Maxim channel radio, so all guys talk radio.
Okay.
I did that till I did the Census Bureau. If anyone was thinking of doing the 2020 census, I highly recommend it.
Yeah, it's like $20 an hour, right?
It's so much money.
Yeah, and you just go and you ask people how many people.
I was the supervisor, so I just told the person which door to knock on.
Oh, so you're just like dispatching?
I just stayed in, you had to pick a spot that you were going to be in for about 4 to 8 hours a day.
Okay.
And then tell the people that worked for you what spot you were going to be in.
Okay.
And most people picked supermarkets that had a little eating area or a Starbucks or a library. I picked my house because I was I don't care. I know all these people. So I just worked from home 4 to 8 hours a day. And I would be like, hey, this is the hours I'm available. And if they showed up, they showed up. And I handed them their packets.
Oh, my God.
I had to train people on how to knock on the door. So I had to get trained on how to do it.
What training goes into that?
If you're an enumerator, which is the base position, which is the one that knocks on the doors.
Yeah.
You had to do a 2 to 3 day thing where they teach you how to read the thing, how to answer questions, if you don't feel safe, blah blah blah, what to do if someone invites you in, all of that stuff, and then you have supervisor training, which is another 2 or 3 days, and then you as the supervisor go train enumerators. So I got trained as an enumerator, trained as a supervisor, and then 3 days later trained enumerators.
Okay, so this is, I'm guessing, a relatively decent neighborhood. How does it get done in really dangerous neighborhoods in the murder capitals of the U.S.?
I would say they probably have to send more than one person at a time.
They armed ever?
I doubt it.
No.
I think it's not worth getting the information.
Yeah.
With the risk of someone's life. So I think if that's the area, they would probably first mail, which they do to everyone. Everyone gets mailed the census. Probably now it's more electronic.
Yeah.
And then they only go knock on the doors of the people that don't respond.
Okay.
So maybe those people.
Oh, that makes sense. And when you were doing this, did you happen to say oh, it's a cute dog, and then it clicked? Or
nope.
What triggered it?
I finished the census. I had nothing coming up on the horizon. I went back to my undergrad to visit some friends that were still there. And my Cocker Spaniel Poodle mix, Elvis, was really sick. And but the doctor that we were seeing kept saying he's going to get better. He's going to get better. Thousands of dollars in diagnostic tests and just, starting to see what was going into it. And, while I was on this little mini trip back to my undergrad, my mom called and she said, we're at the ER and he's not going to make it and we want you to come home. So I flew home early and I spent the next 2 days in the ER with my dog and listening to everything what was going on. And it was the first time in my life where I looked up and everyone seemed to like have a purpose, whether or not they looked happy about it, but the guys cleaning the floor, receptionists answering, people taking payments, doctors are seeing this, techs are doing this. And then I thought to myself, I could probably do this, something in this field. And if you're going to be in the field, you might as well go for as top as you could get.
Yeah.
So I euthanized my dog, went home and I cried for the rest of that day. Mm-hmm. The next morning I woke up and I went to that same community college I took geology that I told you about. That was within walking distance of where I grew up.
Nice.
And I said, I'd like to go to vet school.
Okay.
And she, or whoever was at the bursar's office or whatever you called it, said, with your transcript, you might not get to go into vet school. And I said, I'm going to pay this school to help me go into vet school, or I'll pay a different community college. And she said, okay. And I spent 3 years studying just sciences because I didn't do any in undergrad except geology. Then I got into vet school.
Okay. So what would be your advice to younger kids, whether they have a bachelor's in something else or they're in high school, route to go?
I would say if you're that young and you've already decided that you want to be a veterinarian, which I think is what most veterinarians say, I think I was the abnormal route. Yeah. You need to just get as much hands-on experience as you possibly can. Most vets places around 16 to 17 will let you volunteer or shadow. And then, around 19, 20, 21, they'll hire you to be assistants if they know you can handle it.
That's it now? Those are the ages? I was 14. I was working at East Village Green.
I don't think we would take a 14-year. I don't think we could legally. I don't know.
Oh man, laws must have changed.
I'm not.
Makes me feel so old.
I'm not in management. I don't have to know those things.
Oh, all right.
But
all right, so hands-on experience.
Hands-on experience. Crazy high science scores. But the thing about vet school is it's so many people that want to go to vet school are cookie cutter. I wanted to do this my whole life. I wrote a college essay about it. I wrote a vet school essay about it. Let me into vet school because all I've ever wanted to be is vet.
So what was yours like?
Mine was
truthful?
Oh, I was 100%.
Okay.
This was totally second career choice, and I was one of the few, 10 people out of my 102 starting class that was not just wanted to be a vet their whole life. So you have to have something that sets you apart as well. Yeah. Some other talent, some other area of interest. One of the kids that went to vet school with me was a baseball player. A few were baseball players. One had done something in IT for a really long time. It's just other things that could set you apart than the norm of, I want to be a vet, I've always wanted to be a vet.
Yeah, I think the one who owned the hospital before Mark, Dr. Dennis Leon, he told me once that in his essay toward, he says, I want to be an engineer. And that's what he started out as. Mm-hmm. And then the person that read it was like, oh, I know your name. I read your letter. That's the only one that stood out to me.
That's the thing. How many essays do they read that are all the same?
Oh, that's probably so...
Hi, my name's X. I want to go to vet school Y because I've always wanted to be a vet. Whereas I decided I wanted to be a vet yesterday and I'm writing this paper today. What? That would be like, what?
Yeah, that's true. That got my attention.
Yes, that was like everything. When you're writing any big essay, the first sentence is more important than anything else. The rest is just filler.
And now that you're about 3 years, I've read on Reddit that this is mostly just for office workers, but if you're at the same job, you'll get 3-4% a year raise. But if you switch jobs, the average is getting 7 or 8% raise each year, or if you switch. Is that the same for vets?
Not really, because there's a lot of different pay scales in different types of hospitals. So there's some that are just base, so you just get your salary, and that's what you get. Some are only production, so it's based on what you earn for the hospital. Okay. Some are base plus production, so you'll get a base, which is your bi-weekly or weekly salary, whatever happens, plus a little bit extra for the more you make over that base. Okay. So it really depends on what you are, what practice you're working for and what their pay scale is. A lot of places were production or base and production and are moving away from production because they didn't think it fostered the best atmosphere. But I think if you have a group of ethical people, there's nothing wrong with production payment.
Yeah. I also think that would really, it would really take good vets that just happen to work for a hospital that has a bad reputation and they're not seeing a lot of patients because of the hospital's reputation. I feel like they get the short end of the stick with that if they're doing production and nobody's coming to the hospital.
Yeah, that's true. Especially if you're only production, because then you're really needing people to come in. At the end of the day, if you work base in production and no one comes in, you still have your base salary to rely on while you still have a job.
And for moving forward, what is like New York where you want to stay? Do you want to practice like in large animals like zoos or go farms? What do you have in mind?
No, I've always wanted to be a small animal, general practitioner outside of, really high interest in being a surgeon. But I think I'm going to stick with, dog and cat GP work. If I ever move somewhere where there is a big horse population, I might get more into equine medicine. But I'd have to really relearn a lot of it. It's been years since I studied anything for horses.
Do you do any surgical things now, like just spays and neuters?
I do spays, neuters. I do a lot of GP generalized surgeries, mass removals, bladder stone removals, things like that, But anything that's a significant risk or a significant level of expertise, we call in a board certified surgeon.
Okay.
I don't have a superiority complex enough to think that I could do everything like that. I took an oath. My goal is to do what's best for the animal, and sometimes that means calling someone who knows more than you in.
Okay.
Often,
yeah.
Actually, that can mean someone who knows more than you coming in.
So what's that surgery called? They do it with the machines, something?
Laparoscopic.
Laparoscopic, yeah. Do you do that also?
I do not, mostly because we do not have the instruments to do that at our facility. And if we did, I'd have to go take probably a week to 2 week training course on how to specifically use those instruments.
What do one of those things cost?
Having no idea, ballparking just the instruments, probably 15 to 25 grand.
Oh, all right.
Maybe more. I'm sure you can get used or refurbished ones.
I remember the X-ray that I think was like $80,000 to switch over from the film X-ray to digital X-ray.
Yeah. You pay that off over years. That's not like, hey, here, give me $80K.
Yeah, no, that's
like every time you take a picture, every time you take a radiograph.
Yeah.
Okay.
Yeah, a little bit. I guess even financing that over like 3 to 5 years, it's still
a
lot each year. But you have good with the small animal practice. Did you ever have to do, like in college, kind of a little bit of everything?
Oh yeah, vet school, you have no choice.
Yeah.
Unless you could prove that you're like really allergic. I met one kid that was definitely allergic to horses, so he was like relieved of having to do any hands-on horse stuff.
I don't think I've ever heard of that.
He still had to learn all the horse stuff. That was my last year at LSU. He could not even walk by the barn. Like, he was deathly allergic to horses.
What was it, the hair?
I don't know. He just, like, everyone knew it about him. If you were to come in from the barn and you saw him, they would all, like, can't go near him.
Oh, fuck. Oh, my God.
But, he managed it.
All right.
But for the most part, yeah, I had no choice. I worked dog, cat, sheep, goat, pig, horse, donkey, and then in LSU, if you take exotics, you might work on anything. I didn't, but I knew people that worked on eagles, squirrels.
That sounds...
I did an MRI on a shark when I was in radiology. It had just deceased, and it had just died. But yeah, it was crazy.
All right, I was wondering, like,
they have MRIs that have it for
water,
animals that are alive that need water, and it just water flows by their gills.
Okay,
it's not like they're really submerged. I think it's a flow by system.
But they get enough to where they can survive.
But they're like tranquilized anyway, so But I know someone. Where did she go? One of my friends, her name is Lauren. She did an MRI on a goldfish at her clinical year rotation, and the person's paid all that money for their goldfish to have an MRI. I thought it was so cool when she told us that story.
What? I mean, that's so small. It's like kind of when you do like rabbit spays, you need to have they're so small. What can you find out on a goldfish
MRI?
Yeah, like everything's so small. Like, do they have the same amount of organs that we do?
No, fish have completely different organs. I bet just with any X-ray, you could zoom in and.
Oh, okay. Fuck.
But I don't know. You probably see if there's any cancer growing.
Okay. Anything abnormal?
Yeah.
Yeah. So when you were in vet school, did you have any people that had like culture shock that had never like volunteered or been in an animal hospital? They're like, whoa, blood, or anything that they just live birth and they just pass out?
There were a few people that passed out for all different reasons.
What caused that?
One girl claimed she was hypoglycemic, but as far as I know, she had never had an issue before or after. I think she just got freaked out and hit the deck hard. When we were doing our intro to surgery labs, you'd have 4 people on a team. So you had primary surgeon, secondary surgeon, scrub nurse, and anesthesiologist.
Okay.
So you got all 4. Primary surgeon's doing most of the surgery. Secondary surgeon is there to help and hold things and assist if the primary surgeon asks for it. And scrub nurse hands the instruments and keeps everything clean while doing it.
Okay.
And anesthesiologist is not looking at all into the surgery and just working
Focus
on keeping
on
the
anesthesia.
patient under
Yeah.
anesthesia safe. So I did my primary, I did my anesthesia, I did my scrub nurse, and it's time for me to be secondary. So I'm like excited. I'm like, I don't have to do all that much, but I know it. I've already done all the other jobs. And the primary surgeon was my friend Nick at the time, and he makes the first incision and he opens the abdomen. He's doing a really good job. And he goes to like open up to see what he did, and I look up and I see a bead of sweat roll down and come off. Like he's wearing a mask and everything, but the bead of sweat just came and it didn't hit the patient, thank God, because that would have really been a horrible contamination. Didn't hit the patient, and just I look up at him after seeing the drop, and it was like someone turned a faucet and the color drained from his face, and he just went down. But I don't know how this guy knew. Loeb, the surgery assistant for the lab, was already running by with a chair, and he was just like, "There's one every lab." Like, scooped him up and wheeled him out. And the doctor comes over and she goes, "Okay, secondary, are you ready to continue the surgery?" And I'm like, "Yeah, I've already been primary. Right on, let's go." So I just walked to the other side of the table and did what I had to do. And he came back to finish. They made him drink some soda, and he literally in that time sweat through his scrubs and his surgery gown completely. Like, he had just voided all of his bodily fluids, and he was like embarrassed. But they were just like, "There's one every lab."
Did you give him fluids after that?
No, they gave, I don't know if he had to go to the doctor after, but they gave him they gave him a Coke to give him some sugar. He said he felt better. He changed scrubs. They gave him another surgery gown, and he went back in. He was good.
Oh, that's hilarious. We had this one volunteer, Amanda. She's actually going to school to be a vet now.
Oh, I know her.
Oh, you know Amanda Rooney?
Yeah.
Oh, yeah. So
she worked there for a few months when I got there.
Yeah, yeah. That's like one of the few people that worked with me, and like one of the
chick,
one of the first days that she was there, she was just watching surgery from the outside, and Dr. Leon was doing a spay, and he gets the uterus out, and without like looking, he chucks the uterus at the glass, and she's like, "Ah!" And then she freaks out, and
that's amazing. I need to meet this guy. I've heard so many good stories about him.
Oh, God, he's great.
So what'd she do? She ran away?
Yeah, she just like freaked out and screamed like, "Oh my God." And then the next day or like 2 days later, she's in surgery and she passes out. And this vet tech, Jackie's like, "Oh my God, what do we do? What do we do?" She's like freaking out because she's like, "Is that under our insurance? Did she hurt herself?" And Doug's like, "She's breathing. It's fine. Just leave her there."
Yeah.
Then she woke up and yeah, it was great. I love stories like that.
When I was doing some tech work in Florida, I met a tech named Danny who had been a tech for like 20 some odd years and just had accumulated knowledge like a sponge does water.
Yeah.
One of the smartest people I ever met. And like, she would have conversations with doctors that were like above other doctors' level of understanding. When she told me a story once of her like first job, she was like 17 and she worked for a vet who was addicted to cocaine. Like, couldn't get through the day.
Was he like functioning?
Like, yeah, but he like, if he wasn't doing the cocaine, he wasn't functioning well. So she said he would do it all day long, before appointments, after appointments, before surgery, after surgery, just to keep himself going.
How much money did that cost him?
Probably all that he was making in his vet practice. And she said one day in the middle of a spay, he had just finished like the last removal of the uterus and was about to start closing the animal. He had a heart attack and died on the spot. So she
had to close it up?
She called 911 and stood over his dead body because he was in the way, and the 911 said, "Don't move him," and closed the dog up so the dog wouldn't die too.
Oh, good.
And recovered the dog.
Yeah,
so it's like,
great.
You hear stories like that, and you're just like, "Oh, well, if crazy stuff like that could happen, I'll be okay."
Yeah, no, there's a bunch of things that happen. Like, I guess it's like behind the scenes things. One doctor I used to work for, he had a just totally unethical. He did a cat spay on the hood of his car. I mean, I know it was clean. The instruments were from an autoclave and everything, but he did like it was a neuter, which it takes like
2.5 minutes.
Yeah, two. So those are very quick, very easy.
I've seen neuters be done like that in barns, where someone just is like, "Hey, that's my barn cat. Could you neuter him?" And the doctor's like, "Sure." Boom, injection, sedation, flip the cat over, like you could just kind of hold the cat almost. You don't even have to put the cat down. But it was just I've seen crazy things happen. You know how they neuter a pig?
Oh.
They just grip the testicle and twist, and as they twist, they pull until it snaps, and the
No,
act
they
of doing
don't.
that causes hemostasis is fine. So it's a grip it and rip it.
Oh my god. That really and they don't feel anything?
They used to not even anesthetize them; they used to just hold them down.
Oh my goodness.
Back in the day, I never did that.
I'm just grabbing. That sounds horrible. My friend, speaking of coke, is a buddy that I used to work with. And he was same thing. Had not an addiction. Yeah, he kind of did, but he was a hell of a salesman though. And he would try to go as long as he could throughout the day without doing any coke. And then, sometime after lunch, 1 o'clock, 3 o'clock, he'd go in the bathroom and he'd do a line of coke. Then he'd come back ready to go. It's like, let's go. We're ready. What's the fastest you've ever seen a surgery done? That should have taken 2 hours. It only took 30 minutes.
So I think there's no should have. It's did you do it right?
Mm-hmm.
And everyone has their own thing. I went to LSU for my clinical year. I was taking my equine surgery rotation with an amazing doctor and just a great guy. And he took about an hour and a half to do a joint, arthroscopy, where he would make the incisions into the joint and put the cameras and the things in, so he could take a joint mouse out of a horse's knee or anything. He would routinely take an hour and a half per joint because he was so meticulous and careful. And I worked for a doctor on an externship who was an equine's racetrack medicine surgeon,
Mm-hmm.
and he did them in a half hour, but their success rate was the exact same.
Oh, that's fucking weird. That's cool.
And he did it in a half hour the same way the other guy took an hour and a half. There's nothing wrong with either of their approaches. Also, the guy that did it in a half hour probably had 30 years more experience than the guy who didn't. But it's just things like that, Dr. Nunez can do a spay in probably, I would say, at least 10 to 13 minutes less than I can.
Yeah, just from the experience.
But
of doing it for 30 years.
It's never been a rush. It's never a game. It's just
he's an
the
old
better
guy.
you do it, the more you do it, the better you get. The things you realize you could do. So I think my first spay when after school was an hour and 20 minutes. My spays now are usually a half hour or less. So it's just in 3 years. So if I do it for another 15 years, maybe my spays will be 15 minutes.
Again.
But I'm never going to rush, so it has to be 15 minutes.
Yeah. Well, isn't it a little bit safer? The less they're under anesthesia, the less risk that they have.
Yeah, but if you rush a surgery and you screw it up, it doesn't matter how long they've been under anesthesia.
That's true. Or what is your favorite tune to do surgery to? What gets you in the
I
mood?
think each surgery should have a different type of music.
Oh, well, wouldn't depend on the mood.
But wouldn't each type of surgery create a different mood?
I guess.
I don't know. I don't know. It's so rare to have a surgery without music. that makes everything feel so much more tense. So I don't know. It should always be something that just kind of chills you out. I guess it depends on the person. I don't know. Reggae, for some reason, I always have loved in surgery. I love country music, but a lot of the people I work with do not.
Yeah, New York
and it pisses other people off. So even though I'd be soothed, the person doing anesthesia might be riddled, and I can't have that.
I remember.
I don't know. I sometimes let whoever is running anesthesia pick.
Yeah.
There's always some form of Disney music going on in the background.
Let it go.
Oh my God.
Love that.
That time I'm like, nope. In surgery, I can't listen to that.
All right, so the stuff that would throw you off your game would be Disney music. Anything else? Hardcore rap.
Yeah, not rap. Any headbang and stuff.
No, you don't.
Rage music.
Oh, you don't like Psychosocial? You don't like Slipknot?
I wouldn't say I wouldn't say I dislike that music. I would not say that music is surgery appropriate for me.
Okay.
Someone might think that's the best surgery music because it drowns out everything else and they can just
Wow.
focus on their own thoughts and what they're seeing.
That makes sense.
But you also have to be able to hear the anesthesia machine and hear your tech and.
All right, that makes sense. I had once I was in high school. This is one of the first times they made an audio track or a CD of our concert. So I was like, oh, I brought this in. We'd listen to it, and I was like, okay, sure. And then there's that. As soon as she heard the violin, it's like, no, I'm not doing it.
Yeah.
The one's doing anesthesia. It's like, okay, fuck me then.
I don't know. I have such an eclectic music taste. I came from such a diverse background of family and what they've listened to that if I put on random on my iPod, I have an iPhone. How old am I? I probably could have like a Seals and Croft, followed by Eminem, followed by Bruno Mars, followed by Chris Stapleton.
That's exhausting.
Then Rage Against the Machine. Like, it is so crazy, my music taste.
Going from one to like, I like most of those, but from one to the other is like that like takes a lot out.
Oh
of you.
yeah, especially when you don't know what's about to come, and when you're driving.
You ever hear of hip hop?
Hip hop.
Hip hop. So it's country rap. It is
like
the
Old
most.
Town Road.
I don't know. I guess that would
did
be
not
considered
enjoy that
hip hop.
song.
I fucking love that song. It's great. Fucking
Dope.
Nuno's over there. It's just like, like bullshit. I don't know.
Wait, you know my new favorite question is why people were out there saying you can't listen to Baby It's Cold Outside, but those same people are listening to WAP
WAP.
on repeat.
Dude, people are crazy now. Dude, has politics ever entered the veterinary scene? Like where you'd say, 'cause I know for humans, like some people are like, hey, what are your political views? I believe in hydroxychloroquine. It works well for this. And like the fact that some people ask that beforehand.
I wouldn't say as much to us.
No.
Because, if someone asked me about that, I'd be like, why is your dog a Republican? Like, what difference does it make what I care about? I care about helping your dog. Unless your dog really wants someone to be president that I don't want to be president, I'm not helping your dog. What the hell does that matter to me? I think in business, first off, I think everyone should be inclusive of everyone else and equality for all. I know I'm like passing over that very quickly, but like when it comes down to business, whatever your opinions are outside of running a business, the only thing that should matter in a business is running a good, effective business for your community. Yeah. So people, I'm sure, are closet racists that run a great business. I'm not supporting that, but run your business well, and then everything else outside of your business is none of your business.
All right, that's cool. I can dig that. And I think we're about to play some games, so we're going to end it here. Right. Doctor, you have a good one? Doctor?
Pleasure.
Peace. Please comment, like, and subscribe. Comments are good for the YouTube algorithm. All right, I love you guys. Bye.